Welcome to Health is Wealth. My name is Joseph Kadri. On today's edition of the program, our discussion will be around the oversight visit carried out by the House of Representatives Committee on Healthcare Services to the Medical and Laboratory Science Council of Nigeria, MLSCN. So many areas, of course, we are looked into, and to the amazement of the committee, they were surprised how the registrar of the council, Professor Tostan Erhabor, was able to navigate his way and to ensure that the ethics of the profession is sustained despite limited resources. Okay, now, if you stay with me on the program, we'll quickly take a look at what the registrar says during the visit. Of course, he welcomed them, told them what the council stands for, especially looking at the act establishing the council, which is as far back as 2003, and the lawmakers actually frowned on it. I said, why will it be, since 2003, the act has not been amended. There are many, gray areas in the act that ought to have been amended. And of course, in a jet age like this, there are also issues, advancement in technology that, of course, would have been brought into the act establishing the council by way of amendment. And so the registrar welcomed the lawmakers, and what they heard actually marveled them. So now let's go straight into what Professor Tostan Erhabor outlined when he welcomed the lawmakers and talked about the fact that for some time, which is about 9 months, the council and other regulatory agencies were not captured in the budget as at 2024.
Science Council of Nigeria, it is with immense pleasure and honor that I welcome you to our headquarters. This is indeed a great day for us as an organization, marking your first visit to the council since your assumption in office. The Medical Laboratory Science Council profession plays a pivotal role in the healthcare delivery system of our nation. We at the MLSCN are the regulatory body mandated to oversee the practice of medical laboratory science in Nigeria. Our core functions encompasses: 1, setting and maintaining professional standards that establish quality education, training, and professional conduct, especially those with propensity of driving competency and ethical practice in the medical laboratory science space within Nigeria. Licensing and registration of qualified medical laboratory scientists, as well as laboratories, to ensure that they meet the standards of global best practices for quality and safety. Determine from time to time the standard of knowledge and skill to be attained by persons seeking to become medical laboratory scientists, medical laboratory technicians, and medical laboratory assistants. Regulate the practice of medical laboratory science in Nigeria. Assess, evaluate, and register foreign graduates of medical laboratory science. Conduct examination for technicians and assistants. Inspect, regulate, and accredit medical laboratories. Regulate the training of scientists, technicians, and assistants in any institution in Nigeria, and give periodic accreditation to such institutions. Provide and maintain separate register for scientists, technicians, and assistants. Regulate the production, importation, sales and stocking of diagnostic laboratory reagents and chemicals. Perform such other functions as may be conferred on us. We implement the above mandates, stroke functions through various departments. Office of the Registrar and CEO, Education Department, Practitioners Regulations Department, Exams Department, Laboratory Inspection and Regulation, Foreign Graduates, In Vitro Diagnostics Department with an ISO accreditation, National External Quality Assurance Laboratory with an ISO accreditation, National Laboratory Equipment Calibration Center also with an accreditation. My Honourable Minister, sir, I want to bring this to your notice that when we took over, these three facilities were not accredited to any standard. We were desirous of rendering quality standards, and we have what we call the tripod of quality. The in vitro diagnostics were meant to validate any reagent that has to be used in the laboratory for quality assurance. National Quality Assurance Laboratory, which is also accredited in Zaria, was also accredited during my time, so that we'll also see peer review of laboratories in the country to see if their results are reproducible. The last on the quality tripod was the National Laboratory Equipment Calibration, which was accredited last year to ASO accreditation also. These three are speaking to international standards. Other service departments are admin and finance and corporate affairs. Sir, the challenges facing healthcare sector today are multifaceted and complex. Emerging infectious diseases, antimicrobial resistance, non-communicable diseases, and the ever-evolving technological landscape demand innovative and integrated approach to healthcare delivery. Medical laboratory science is at the forefront. Medical Laboratory Science Council of Nigeria is at the forefront of addressing these challenges. Accurate and timely laboratory diagnostic and essential for early disease detection, which enables prompt and appropriate treatment, improving patient outcomes and reducing morbidity and mortality. Medical laboratory science guides treatment decisions based on individual patient characteristics and genetic profiles. Currently, sir, MLSCN is implementing our core mandate from various states' offices with our headquarters situated here in Abuja, where you are today, sir. We have 12 offices, 6 zonal in the 6 political zones and 6 state offices. I'm happy to inform you, Honorable Minister, that out of these 12 offices, the only one that we pay rentage for is only the one in Kano. Others are either located in the state secretariat or federal secretariat in the state where they are located. Sir, we believe that a strong and well-supported medical laboratory profession is essential for achieving universal health profession, health coverage, as well as improved health and well-being of all Nigerians. We therefore seek continued support and guidance in the following areas: resource allocation, adequate funding for nationwide inspection against quackery, infrastructural development, investment in modern laboratory infrastructure and equipment in other states of the Federation to enhance diagnostic capabilities. In the area of human resources development, we solicit your support to ensure that only licensed medical laboratory scientists are employed at establishments by your office. Well, what we are trying to explain here is that, Honorable Mr. Sam, as you visit your the service areas, we are calling on you, Sam, to always ask them about their laboratories. In line with our functions, it is better for their laboratories to be well equipped to face the challenges. Because as we go there, you will see a lot of decayed equipment in most of these facilities. The successes we have recorded over the years were not achieved without the instrumental support.
Outlining the operations of the council, which of course has 11 state offices, including the FCT, making it 12. Ordinarily, if there's resources, the council ought to oversee the entire nation and of course have offices in the entire nation, and which of course he specified in that comment where he said there is need for some kind of increase in the budgetary allocation to the council so that the council can actually expand its scope and ensure that the profession has those that are qualified and also tackle quackeries. The issue of quackery is not only related to the practice of medical and laboratory science, but it cuts across every other sphere. But for the medical laboratory practice, there ought to be zero tolerance for malpractice and quacks, because medical doctors rely on the results churned out from the lab. Accuracy of the result will, of course, gives you accuracy of the prescription. If you have misdiagnosis, the prescription will also be missed. So much must be done to ensure that the practice has zero tolerance for quacks. Now let's hear what the chairman of the House Orientative Committee on Healthcare Services, Honorable Amos Magaji, has to say in his opening remarks, and after that he also yielded the floor for his members to also chip in and ask some questions.
Medical laboratory science is a very, very important aspect of healthcare system, healthcare delivery. The medical laboratory shine lights onto clinical practice. Often when we make our clinical diagnosis as clinicians, often when the clinical, the laboratory diagnosis comes, it's like shining a light, then you feel confident that yes, truly, for example, you are suspecting meningitis. When you go and do the culture and you actually identify that, okay, then you feel comfortable that you're right. This is what I am in the right track. So it's like shining a light onto a dark spot. So your importance cannot be underestimated in the delivery of quality healthcare system in our country. And we've seen a lot of times that misdiagnosis has led to a lot of mortalities, disabilities, and sometimes loss of life. So we must continue to prioritize what you do. And I want to assure you that the Federal Ministry of Health and Social Welfare, and indeed the President Bola Ahmed Tinubu, will continue to support your efforts to ensure that you are able to perform your responsibilities. I'm happy that some of the development that I've seen going around, I'm happy that the penetration of digitalization in your operation is quite high. This is something we must continue to improve on. This is age of digitalization, and we must not lag behind in it. And that is why I wanted to visit first, see what you have on ground before I talk, because I should speak to what I see, rather than what you tell me alone. So I've gone there and I've seen, and I want to encourage you to continue in that direction, increasing the communication in your operations. I'm also happy that the level of efforts, level of services that you've been delivered at the bus safety end of your operations, and the kind of training that you're able to deliver to people is also something that is encouraging, and this is something also we must continue to expand on, and we must continue to do. There's no doubt that as a regulatory body, you are in charge of the professionals within the space, laboratory scientists, laboratory assistants, and technicians. And you have the law behind you to regulate these practices. Therefore, if you are talking about not having qualified people employed by employers, then I'll throw it back to you that it is still within your labs, because it is your responsibility to ensure that anybody that is not qualified does not practice in Nigeria. Anybody that is not licensed cannot practice in Nigeria. It's your responsibility. Not my responsibility as Minister of State or the authority of the Federal Ministry of Health and Social Welfare. The law is behind you. You can sanction practitioners who are quacks, and I believe you can also sanction employers who employ quacks. So you just have to sit up to your responsibilities, and digitalization is also going to help you in that. If you have a record of all the laboratory scientists in Nigeria, all the laboratory technicians, all the laboratory assistants, you must also be able to track them where they are at any point in time, because that is the essence, especially once they are still in this country. You know, you must be able to track them since they come to you annually for the renewal of their license. And those who doesn't come, you must also be able to track it. So you must move your digitalization effort to be able to flag people that have not come for renewal. I believe that that is the direction you must go. If you have about, I think, 15,000 registered? 35,000 scientists registered in your database. You know, I'm happy that you are improving in the level of certification that you are getting, but it is not acceptable for anybody to practice in Nigeria and not be certified. The essence is for you to have 100% certification of all the professionals. So that is the direction I believe we must aim at working towards. Therefore, I want to challenge you to ensure that you monitor your members, and the members that are not licensed, you are able to sanction them. Employers that are employing unlicensed, uncertified quacks, you are also able, because I believe you can also do something about those employers. Let me also use this opportunity to point your attention and first thank Mr. President. I'm sure you're all aware that prior to this administration, for about a year, you were defunded, and I think that most of you could not get your salary until Mr. President intervened and returned you to the budget fund.
From the chairman of the committee as well as his colleagues, what we can vividly deduce is the fact that they were satisfied with the operations of the council, and so they were taken to a guided tour of the facility of the MLSCN, where they visited the Biosafety Center, also the NALEC Center. And then after that, they all gave their concluding comment on the outcome of the visit. And I can tell you that the chairman of the committee was really satisfied with what he has seen so far with the work of Professor Tosan Erhabor, trying to, of course, reshape the practice of medical laboratory science in Nigeria. Let's take a look.
sections. You have the repair and maintenance sections, and you have the safety training section. So under these sections, this is where we can get our auxiliary laboratory equipment. Here we have. This is the maintenance and repair section, so as to maintain our equipment in the laboratories and repair them, so as to ensure the longevity of this equipment. Because you realize in so many establishments, they are breakdown equipment.
Not just for calibration alone, there are some faults that need to be undertaken by that to be taken from that equipment. We first of all maintain it to be in a functional state. That's why.
Yeah, paramedic engineers.
Yes.
So this place, during this period, we are able to train a lot of scientists that are some of these public labs, just to train them to know how to use it and maintain it. And we also train them that if any satisfier is coming, this and this and these materials it needs to come with for you to know that actually they are going to do a good job for you so that you don't expose to politics. In the country, not only in Nigeria. So by the time this is coming to me,
so I'm also partner we have for the knowledge and this place is ISV. They been of immense support to us. And what gave birth to this is, yes, COVID. But if you look Nigeria today, we don't have up to 10 biosafety, and they came and they said it is a worldwide event, a venture for West Africa. And well, just started. Within this year, this place is going to be certified by NISC, the international body that certifies biosafety training. I will be certified. That is the goal of this certification center.
And to make sure that we reduce or eliminate quackery as much as we can. So we computerized our process. That's the associates and fellows, they have the license. And most based on the security features that we have within this. So
under your ministry, we have the National Laboratory Quality Assurance in Nigeria and other partners and MLSCN. What we do in that team is to ensure that every HIV test kits and those test kits are also used for STI, syphilis, and hepatitis that come into this country via the Abuja ASIS are validated in this facility. Carry out post-market validation. We report through the national 2 year. We also provide quality assurance panels across the country. We do not have facilities for them to provide. We make collaborate with partners, CDC, IUN, to periodically provide standardized panels to ensure that the testing going on there meets the quality assurance. And also, we bring these people here to train them.
Medical laboratory science is a very critical element of the healthcare system. Without laboratory diagnostics, a lot of times as clinicians, you'll be groping in the dark. Clinical diagnosis is often not enough. And when you have laboratory diagnosis coming in, you feel more confident, more assured that yes, you're heading in the right direction. So the MLSCN and the profession that the body regulates is very, very critical to the healthcare system. I've seen the facilities here. First, I must congratulate the registrar and his team for keeping the premises very clean. I think that they are one of the few regulatory bodies with a building of their own, which is very good. And I've seen the efforts that they are making in improving what is being done here, the level of digital penetration into their processes, what they're doing with biosafety training, biosafety certification, and I've challenged them to go further, not to rest on their oars, because the world keeps changing and development is happening every day. Clearly, we can be assured that the laboratory science profession in Nigeria is being well regulated by this body.
Thank you very much.
Not enough for me to tell the world that I'm elated that the minister came, saw, and conquered. I'm very grateful for this day. And with his words of encouragement, we are going to do more for the benefits.
Very, very clear. There's a need to ensure that the results, the medical laboratory results from Nigeria is accepted in any part of the world. It's a standard the lawmakers want. It's a standard the registrar of the council has been, carrying out. It's a standard practice, which is why the MLSCN has got 3 international ISO certification, and we only hope that when the lawmakers return, they will look at areas, gray areas, to address, to amend, so that the council will have unhindered access to ensure that facilities, be it public or private, subject their facilities to regular accreditation in such a way that whatever result they churn out will be accepted in any part of the world. This is where we wrap up to this edition of the program Health is Wealth. Until I come your way again, Joseph Kadri is my name. Do enjoy the rest of